Well, hey Anatomy, welcome to the last video of online pandemic, Zoom, YouTube, check-in learning. Today I hope to give you a brief introduction and just really an overview of the respiratory system. We're not going to go too in depth with this, but I do want to just allow you to have a brief, stepping into the pool of knowledge in the respiratory system. So this is the organization of the respiratory system. Of course, if you've ever been short of breath or have ever dealt with asthma or coughing, I grew up with asthma. You realize how important it is to breathe. Of course, so many people are perishing tragically from COVID-19, and most of it's due to, well, I don't know about most of it, but a lot of it's due to respiratory failure, pneumonia, not being able to breathe. And just imagine the struggle, how scary that would be. And so this is the general structure of the anatomy of the respiratory system. So a couple of things, just to try and bring this to importance. I grew up with asthma, so this man's taking an inhaler. I don't know if you ever had seen someone undergo an asthma attack. It's very scary. I remember going through many in my life and having to go to ER a few times, and it's scary. I know what it feels like not to be able to breathe, and you don't forget that feeling. That's why I've never smoked. I don't want to ever have that feeling again. This is Apollo 13. There's an issue with carbon dioxide, too much carbon dioxide in the capsule that was protecting Lovett and the other guys. And so, that's important. Hyperventilating. Of course, that's from the show Big Bang Theory. But hyperventilating also involves the respiratory system. And then God's word talks about our breath came from God. He is our breath. He allows us to breathe. God's word talks a lot about breathing. And so questions part one. So remember, I'm going to ask you one more set of questions, one more video. So questions part one. What is asthma? So look at that definition and what causes it. Are there any risk factors? Can it be genetics, environment? There are some interesting studies about the environment, how the environment can influence asthmatic development, etc. And then what is occurring inside the body during hyperventilation? Why does breathing in a bag help? I want you to look up those things. So here's the respiratory system: nose, nasal cavity, sinuses, pharynx, larynx, trachea, bronchi, bronchioles, and alveoli. Okay, so that is the general outline and flow of the respiratory system. So you ever have an upper respiratory infection? That consists of the nose, nasal cavity, sinuses, and pharynx. Lower respiratory system begins with the larynx and then goes all the way to the alveoli. So what are the functions? Of course, always know functions. Functions are very important. So the functions of the respiratory system, again, this is just a partial list, but the most important items are gas exchange, protection from dehydration, protection against invading pathogens, breathing in a virus, for example, sticks in the mucus, possibly your immune system can take care of it, produces sound, we will talk about that, and assists in regulation of blood volume, blood pressure, and body pH. And so it is very important to have all that. So you can see this is just another picture of the respiratory system. You can start up here with the nose. Here's your mouth. This is a sagittal cut separating the left and right sides of the body. The man's looking to his left. And so you can see here's the pharynx, 3 different parts of the pharynx. Here's the larynx, which houses the vocal cords. We'll talk, and then the trachea, which is your windpipe. If you would have felt this in the cat, it would have felt very ridgy, like ridges. There's ridges on it. Ridgy's not a word. And then and then it starts branching like a tree into various tubes. And so the structural plan is a tube that branches, which ends in millions of tiny thin-walled sacs called alveoli. So this is where gas exchange occurs. Looks like little grape clusters, but that's where gas exchange occurs. And so the respiratory system helps us maintain homeostasis because we need oxygen, of course, but we also need our carbon dioxide levels to be maintained within a certain level. And so, muscles release carbon dioxide, so blood increases. Blood, the levels of carbon dioxide increase. There's receptors that notify this, and so we increase respiration to get that carbon dioxide out and to get more oxygen in. The system also warms, filters, and humidifies the air we breathe. I don't know if you've ever been in cold weather, but sometimes it can get so cold that it hurts to breathe. My cousin lived up in North Dakota, which is crazy. and crazy cold, and so that was an issue for him. But so the reason I show an upside down tree here is because the respiratory system is literally like an upside down tree. It begins with one big tube, so you have your nose and the larynx, and then you start with this one main trunk, and then it branches twice, and then it keeps branching and branching and branching until you finally reach the leaves in this analogy, and the leaves would be considered the alveoli, these little these little sacs, where gas exchange occurs. Okay, and so the upper respiratory system consists of the nares and the nasal cavity. The nasal cavity allows for like swirling of air to happen. If you ever done a neti pot or anything, you know what it feels like to get water up in there. And then post nasal drip. If you ever heard of that term, that's when your allergies or mucus is causing like a drip constantly down into your throat, so your throat can be irritated or you can cough a lot. So that would be obviously very problematic. I have a lot of that due to my allergies. But the pharynx is a passageway that connects the nose to the mouth and to the throat. Okay. Now here is the three regions of the pharynx. So in order, it's NOL, naso, oro, nasal means nasal, oro means mouth, laryngo, which means near the larynx. The epiglottis is an amazing structure. I don't know if you ever choked. Some people obviously perish by asphyxiation by choking, which means they can't breathe. Something went down the windpipe, the trachea. But the epiglottis is a fold of tissue that actually closes when you swallow. So when you're laughing or talking, that it's not completely closed, and so it increases your chances for choking. But that's, of course, not something we want to do. And we're teaching my littlest one to eat right now. It's fun and stressful, but a cylinder whose cartilaginous walls are stabilized by ligaments. So there's cartilage here, the larynx, and this is where your thyroid, your Adam's apple comes into play, the thyroid cartilage right there. That's where the larynx is, okay? And so the respiratory system has many different, epithelial cells, pseudostratified, ciliated, columnar, but I'm not going to discuss that in this video. Okay, so there's an amazing video. Her name's Debbie Austin. I encourage you to look it up on YouTube. But she smokes through a stoma, which is basically an opening. I don't know if you've ever seen those anti-tobacco commercials where they put the vitamin and then they talk and they have a hole in their throat. Well, that's because of damages to the larynx, damages to the respiratory system, and so they have to breathe through that hole, that stoma. But she actually smokes in that stoma. And her famous line is, they say cigarettes aren't addicting, and she smokes in it, and she says, I believe, how can they say that? It was a drug-free campaign ran in California. Really amazing video. I encourage you to check it out. It changed a lot of people's lives. But coughing, so why do we cough? Well, coughing is a protective reaction. I don't know if you ever had a coughing fit. One time I was mowing, ran over sand, and I coughed for like minutes. But which irritate so a dry irritated cough can occur when inhaling smoke, but it stops after the smoke has been coughed out of the lungs. So the first time you take a puff of a cigarette or vape, you will cough because the body's like, this is toxin, this is smoke, get it out of my system. However, why is smoking so bad? It destroys the cilia. So this cilia is what kind of causes the coughing reflex, trying to get all these pathogens up, little hair like the sweet harmful particles out of the lungs. Well, cilia can no longer sweep those harmful particles, and smoking damages and kills it. And so this leads to a buildup of mucus, and that's goes into the smoker's cough. But not only that, those toxins are staying in the lungs. So question part 3, why is smoking so addictive? You also have to look up nicotine and the effects on the brain. And we talked a little bit about that in the nervous system. But why is smoking so addictive? Okay, so the anatomy of the nasal cavity, we already talked about that. There's many different folds in it, allows the air to be warm and humidified. Nasal sinuses, you have cavities within your skull. I don't know if you've ever had a sinus infection or sinusitis, but you have cavities within your skull, allowing the skull to be lighter, allowing you also to have the ability to talk and speak. If you've ever noticed you sound a little sick, you sound different when you're sick, produces mucus, and so sinusitis is an inflammation of sinuses, and so it can be very problematic. Okay, we already talked about the pharynx, so let's go with this. This is a fun little game to do, breathing in helium. If we were in class, I'd show you some videos about this. But yeah, that's question part 3. Why does your voice change after inhaling helium? I don't know if you ever did it, but you're actually suffocating. You're not breathing in air, you're breathing in helium, so you're basically holding your breath. But I'd like for you to look that up. So this is a picture of a cadaver sliced with a sagittal cut. You can see the vertebrae here, C3, C4, cervical vertebrae, thoracic vertebrae right there, the little curvature of the spine, the tongue here. But here's the trachea. You can see right there, there's a trachea. There's the esophagus. The esophagus is what food goes in. So you can see right beside each other. It would have been amazing to see in the cat. Sorry we didn't do that this year due to the pandemic. And then there's, the nasal concha, which is the folds right there. And so that's just a general picture of where the trachea is. Pleural cavity houses the lungs, aortic arch, which is the aorta. So the larynx, the next stop is the larynx. And a larynx is a structure, it's a piece of cartilage forming a network. And so it's basically the thyroid cartilage, the Adam's apple, and the epiglottis partially covers it. So that epiglottis is crazy important to prevent us from choking, which is, of course, that's what we want. So air distribution and voice production. This is what the larynx does. And so you can see here, here's the epiglottis. Again, that would have been really cool to see in the cat. Here's the trachea, and there's your vocal cords. And I'm going to show you a video when we meet in Zoom about, a vocal cords being used. But here's what they look like, and it's pretty amazing when you see how they sound. But the sound down there is not very distinct. It's basically just like air movement. The reason we get distinct sounds is because of our arrangement, our anatomy, sinuses, articulation with our mouth and tongue, and also, the force of the air. And so the larynx is the voice box, routes air, plays a role in speech. Structure of the larynx also has, different, I guess, functions, but I didn't want to say, anatomy than the trachea, but it obviously is surrounded by cartilage. Okay, so here's a picture of the scope picture. That's someone's windpipe and vocal cords. And there's a person's epiglottis right there. And so vocal cords vibrate with expelled air to create sound. And the glottis is the opening. And so how does sound production actually happen? Well, a pitch depends upon the diameter, length, and tension in the vocal cords. Children have slender, short vocal cords. That's why they have high-pitched sound. At puberty, the vocal cords of males become thicker, which is always fun. Voice cracks, glorious. Amplification of sound occurs in the sinus cavities, and then production of definite sounds depends upon the movement of lips, tongues, and cheeks. And so this is how you make sounds. So the glottis is where the air passes through. These vocal folds vibrate when sound goes through. That contains ligaments and muscles, of course. And then there's two different words here that I want you to understand. Phonation and articulation. Phonation is the vibration of vocal cords producing sound waves, but they're not distinct. Articulation is modification of sounds by tongue, teeth, and lips. So that's questions part 4. I want you to describe how your body produces sounds. I want you to contrast phonation and articulation. Okay? We already discussed the epiglottis, crazy important when it comes to eating correctly and not choking and going to meet Jesus before your time. Well, I guess it would be your time. God's in control. But nonetheless, choking, you don't want to do it. So here's, again, we already talked about swallowing. There's that epiglottis right there. We talked about this in the digestive system. But there's that epiglottis closing, protecting food from going down the wrong pipe. And that wrong pipe would be the trachea. The trachea is the windpipe. So it is layered with hyaline cartilage, so protective, right? I don't know if you've ever been hit in the throat, but it hurts, but you don't, your throat didn't collapse. You're protected by that cartilage. So it's very, very important. Again, it's a pathway for air, covered with mucus and cilia, protects by trapping and eliminating pathogens. And then finally, let's go on to the primary, the last couple of stops in the upside down tree. Primary bronchi, this is the first division. And then they divide into smaller and smaller branches. So you can see here the picture here. You have your primary bronchi. Bronchus is singular. Then your secondary, tertiary, bronchioli, and then finally that bronchioli eventually ends in the alveoli, which is where gas exchange occurs. So one more time: primary, secondary, tertiary, bronchioli, and that's where it ends. And so the respiratory zone is the site of gas exchange, and this involves those grapes or the alveoli that we've been talking about. And so literally you can see here the capillaries surround the alveolus. Alveolus is singular. It's where gas exchange occurs. CO2 goes in to the alveoli, oxygen leaves and goes into the blood, which is going to be returned to the heart to deliver that oxygen-rich blood to the body in order to be able to create ATP through it. Okay, so this is what they look like. Let's show a more advanced picture here. But here's the alveoli, pulmonary veins. You know, that's going back to the heart, oxygen-rich blood, right? Arteriole, there you go. And so this is a little flipped in the pulmonary circuit, right? Arteriole, arteries are taking oxygen, poor blood in the pulmonary circuit, and veins are taking oxygen-rich blood back to the heart to pump it in the body. But this is where gas exchange occurs. It's pretty amazing. Here's another picture here of showing that. So O2 goes into the capillaries right here. CO2 goes into the alveolus so we can breathe it out. How do these, air sacs basically not, fall apart, not collapse together? Well, there's liquid around them called surfactant, and there's also cells secreting that and epithelial cells, and so there is some organization here. But surfactant is very important. It's a complex and highly active material composed of lipids and proteins, which is found in the fluid. Surfactant prevents, here it is, alveolar collapse at low lung volume. So when you breathe out, this does, technically they should collapse based upon pressure differences, but they don't. So in addition, it is involved in protection of the lungs from injuries and infections caused by inhaled particles and microorganisms. Okay, but IRDS, I want you to look this up. It's if you look up that video or some videos about it, it's very, very sad to hear children having this. But question part 5, what is IRDS? And how does it involve surfactant? Okay, so finally, one more time, gas exchange, alveoli, oxygen goes in, CO2 leaves the capillaries. We need oxygen to attach itself to hemoglobin and red blood cells to be delivered to the tissues of our bodies. We have to have that. And the last thing briefly are the lungs. And so the lungs occupy most of the thoracic cavity. Here's what they kind of looks like. You can see here the right lung and the left lung. You're looking at someone else's body in anatomical position. So the sternum and the xiphoid process, and you can see here that the left lung has more lobes. So does the right lung. The right lung has 3 lobes, and the left lung has 2 lobes. And here's what it looks like inside of a cadaver. You can see the various lobes there. The apex is the top. It rests on the diaphragm, which is down there. There's cut edge of the diaphragm, the muscle that helps increase that thoracic volume. We're not going to go into how respiration works, the muscles involved. That is interesting, though, to say the least. But so here's our last question. I'm sure you're excited. If you watch this long, you're a rock star. Question part 6. I want you to trace the path of air from the nasal cavity, or the nares, the nose, to the alveoli. I want you to trace that path. Include all the different bronchi and the divisions. Being able to trace the path of air is helpful, okay? Hope that these videos were helpful, guys. I miss seeing you. I hope you end your school year on a high note. Jesus loves you so much. Hope to see you soon. God bless.